Imagine, in the middle of a conversation you suddenly feel an overwhelming wave of sleepiness. You can't fight it, and within seconds you're fast asleep. This is a reality for people living with narcolepsy. Hello, this is Matthew sitting in for Diva, and welcome back to our channel. Today we are talking about narcolepsy. Let's get started. When it descends upon you with such force that you can't resist, pulling you into its depths even when you're in the middle of an important task? For most of us, this is a rare occurrence, usually after a long day or a sleepless night, but for those living with narcolepsy, it's a daily struggle. Picture this: you're driving home after a long day at work, your favorite song playing on the radio, and suddenly, without warning, sleep engulfs you like a thick blanket. Or you're at a dinner party laughing at a friend's joke when an irresistible wave of sleepiness washes over you. Before you know it, you're slumped over your plate, fast asleep. This is narcolepsy, a neurological disorder that affects the brain's ability to control sleep-wake cycles. It's not just about falling asleep unexpectedly, it's about the constant battle to stay awake, to be present, to live a normal life. Living with narcolepsy can be challenging, to say the least. Simple tasks like cooking dinner, watching a movie, or even having a conversation can become Herculean tasks. And it's not just about the physical challenges. The emotional toll can be just as heavy, affecting relationships, work, and overall quality of life. Imagine the frustration of constantly fighting sleep, the embarrassment of falling asleep in inappropriate situations, the fear of not knowing when the next sleep attack will strike. It's like living on a sleep-deprived roller coaster, with highs of wakefulness and lows of sudden, uncontrollable sleep. But despite these struggles, people with narcolepsy are not alone. With the right information, support, and treatment, it's possible to manage this sleep disorder and lead a fulfilling life. So, what exactly is narcolepsy and why does it occur? Let's delve deeper into this sleeping disorder. Before we move on, if you're finding this video informative, give it a thumbs up, and don't forget to subscribe for more enlightening content. Narcolepsy is a neurological disorder that affects the brain's ability to control sleep-wake cycles. A seemingly simple explanation for a condition that can have a profound impact on a person's life. But what does it really mean? Narcolepsy is a chronic sleep disorder, and it's all about the brain's struggle to regulate the boundaries between wakefulness and sleep. For most of us, these boundaries are clear-cut. We're either awake or we're asleep. But for someone with narcolepsy, the lines blur, leading to unexpected bouts of sleep even in the midst of activities. Now let's delve into the two types of narcolepsy. Type 1 and Type 2, not so creatively named, but each presents its own unique challenges. Type 1 narcolepsy involves not just sleep attacks, but a phenomenon known as cataplexy. This is a sudden and uncontrollable muscle weakness or paralysis, often triggered by strong emotions. Imagine laughing at a joke and then finding yourself unable to move. That's the reality for some people with Type 1 narcolepsy. On the other hand, we have Type 2 narcolepsy. This form of the disorder involves sleep attacks, but without the cataplexy. It's a bit like having an unwelcome guest who shows up unannounced, only this guest is sleep, and it can arrive at the most inopportune moments. In both types, these sleep attacks can last anywhere from a few seconds to several minutes, and they can occur multiple times throughout the day. And it's not just about excessive sleepiness. People with narcolepsy often struggle with fragmented nighttime sleep, meaning that even after a full night's rest, they may still feel exhausted. So, to recap, narcolepsy is a neurological disorder where the brain struggles to regulate sleep and wakefulness, leading to sudden sleep attacks, and in some cases, cataplexy. Recognizing the symptoms of narcolepsy can be the first step towards managing this condition. But what are these symptoms? Stay tuned to find out. Narcolepsy can manifest in a variety of symptoms, some more common than others. To better understand this condition, let's delve into some of these symptoms. Excessive daytime sleepiness, or EDS, is often the most noticeable symptom. It's characterized by an overwhelming urge to sleep, often at inappropriate times. It's like feeling incredibly tired, even after a full night's rest. This isn't just your typical afternoon slump, but a persistent, uncontrollable need for sleep that can strike at any time. The next symptom we should discuss is cataplexy. This is a sudden loss of muscle control triggered by strong emotions like laughter, surprise, or anger. It can range from a slackening of the facial muscles to a complete collapse, although the person remains fully conscious throughout the episode. Sleep paralysis, another symptom, is a brief inability to move or speak while falling asleep or waking up. It can be a terrifying experience, but it's important to remember that it's temporary and harmless. Hallucinations are also a common symptom, particularly upon waking or falling asleep. These can be incredibly vivid, often involving sights, sounds, and sometimes even touch. These are known as hypnagogic hallucinations if they occur while falling asleep, and hypnopompic if they occur upon waking. Lastly, disrupted nighttime sleep. Despite the excessive sleepiness during the day, many people with narcolepsy struggle with maintaining sleep at night. They may wake up several times throughout the night, making it difficult to achieve restful, uninterrupted sleep. These symptoms may not all be present in everyone with narcolepsy, and their severity can vary greatly from person to person. It's a complex condition that can have a significant impact on a person's daily life. From their work performance to their social interactions, early detection can make a significant difference. But what happens after a diagnosis of narcolepsy? Diagnosing narcolepsy involves sleep studies and potentially CSF, hypocretin 1 levels testing. So let's dive deeper into understanding this process. Typically, the process of diagnosing narcolepsy begins with a detailed medical history, followed by a physical examination. Doctors often ask about sleep habits and the presence of other symptoms like sleep paralysis or hallucinations. If narcolepsy is suspected, the next step is usually a sleep study. Sleep studies are performed in a sleep lab where your brain waves, heart rate, and eye movements are monitored throughout the night. This helps to rule out other sleep disorders and confirm a diagnosis of narcolepsy. In some cases, a specialized test called the Multiple Sleep Latency Test, or MSLT, is used. This test measures how quickly you fall asleep during the day and how quickly you enter rapid eye movement, or REM sleep. In addition to sleep studies, doctors may also test the levels of a brain hormone called hypocretin 1 in the cerebrospinal fluid. People with narcolepsy often have lower levels of this hormone, which helps regulate sleep and wakefulness. Once a diagnosis is confirmed, treatment options can be explored. Treatment for narcolepsy typically involves a combination of medications and lifestyle changes. Medications can include stimulants to help stay awake during the day, antidepressants to control symptoms like cataplexy, and sodium oxybate to help improve nighttime sleep. Lifestyle changes can also play a significant role in managing narcolepsy. Regular exercise, a healthy diet, and maintaining a consistent sleep schedule can all help reduce symptoms. Avoiding caffeine and alcohol, particularly before bedtime, can also be beneficial. Support groups can be a valuable resource for people living with narcolepsy. They offer a space to share experiences, learn from others, and find comfort in knowing you're not alone. Living with narcolepsy can be challenging, but with the right strategies, it is manageable. Remember, everyone's experience with narcolepsy is unique, and what works for one person may not work for another. It's important to work closely with your doctor to find the best treatment plan for you. Let's recap what we've learned about narcolepsy. It's a chronic neurological disorder that affects the brain's ability to control sleep-wake cycles. This isn't your run-of-the-mill tiredness. It's an actual medical condition that can significantly impact a person's life, from their daily routines to their relationships. We've also gone over the symptoms of narcolepsy. They can vary from person to person, but some of the most common ones include excessive daytime sleepiness, cataplexy, sleep paralysis, and hallucinations. Excessive daytime sleepiness is the hallmark symptom, where individuals feel persistently tired and may fall asleep involuntarily during the day, irrespective of the situation or activity. Cataplexy is a sudden loss of muscle tone, often triggered by strong emotions. Sleep paralysis and hallucinations typically occur as one is falling asleep or waking up. Diagnosing narcolepsy is a process. It usually involves a clinical evaluation, detailed medical history, and specialized tests. Sleep studies like polysomnography and the multiple sleep latency test are common diagnostic tools. It's essential to consult a healthcare professional if you suspect you or someone else might have narcolepsy. Now let's move on to treatment. While there's currently no cure for narcolepsy, symptoms can be managed with medications and lifestyle adjustments. Medications may include stimulants, selective serotonin reuptake inhibitors, SSRIs, or sodium oxybate. Lifestyle modifications can involve maintaining a regular sleep schedule, taking scheduled naps, and ensuring a healthy diet and regular exercise. Remember, narcolepsy is not a one-size-fits-all condition. Each person's experience is unique, and what works for one individual may not work for another. It's crucial to work closely with a healthcare provider to find the most effective treatment plan. Remember, if you or someone you know is experiencing symptoms of narcolepsy, seek professional help. Early detection and treatment can significantly improve quality of life. If you found this video helpful, share it with others who might benefit from this information. Again, this is Matthew sitting in for Diva. Thank you for watching.